Namaste all the viewers and friends. Today we have come up with our next topic of discussion, and before we begin that, we would like always like to thank all of you who have subscribed to our channel, who are viewing our videos and are encouraging us to do these videos. Please share these videos amongst your loved ones for whoever it is in need of. So today the topic that we want to talk to you about is plantar fasciitis. That means inflammation of the plantar fascia. What is plantar fascia? It is a very thick band of tissue that is present in the sole of your foot that connects the heel bone to the toes. So it is a very thick band of tissue. If that gets inflamed, then every time you place your foot on the floor, there is going to be a sharp stabbing pain. Usually this pain is intense or is felt more early in the morning when you keep your first step on the ground after you wake up, or it can also be after long hours of sitting. If you are continuously in a standing position, if you are putting a lot of strain on your feet for various reasons, it could be any of the activity that strains the feet for a constant period of time. These are the times when you feel the pain, feel the prick, feel the stabbing pain in the feet. It can happen unilaterally or bilaterally. Either it can happen in only one foot, or it can happen in both the feet. There's a possibility of that as well. And neuropathy, be it because of diabetes or any other conditions that lead to neuropathy, can aggravate plantar fasciitis because the fascia is already inflamed and neuropathic changes can make it worse. Or if there is any circulation issue of the ankle or of the feet, if somebody is having a lot of sedentary lifestyle and they're not moving about, if somebody is overweight or obese, that can also complicate plantar fasciitis, and these are definitely risk factors for the development of plantar fasciitis at the same time. So usually seen between 40 to 60 years of age. This is where we see it usually, and for a lot of people it is more either in winters or when the summer is in its peak, because these are the two seasons when the inflammation in the body can go up. And for somebody who's always prone to heat or heat symptoms, they see it in these two seasons, peak winter and peak summer. And also, if our lifestyle is contributing to aiding inflammation in the body, it can again contribute to plantar fasciitis. The kind of footwear that we use, if we use pointed heels, if we use footwear that do not support the arch of the feet or the entire feet properly, that can also be a risk factor and can aid in the development of plantar fasciitis. Especially people with flat foot, they are always at risk of developing plantar fasciitis. So how do we manage it? First, we recognize these symptoms, the pain, when it is coming, when it is aggravating. Once we recognize it, there are certain home remedies that will help, and when those home remedies do not work, you need to seek therapy. Usually there is no requirement of any scans or tests to be done to see the fascia being inflamed. Clinically, it is always diagnosed. So let's understand the role of acupuncture in management of plantar fasciitis. Acupuncture, we've understood in so many videos, is a traditional system of medicine which is very scientific in nature, which works on bringing down the inflammation in the body. Be it any part of the body, it brings down the inflammation. So when fascia is inflamed and when the acupuncture needles are put in the area and certain general points that help in bringing down the inflammation, we see gradual reduction in the symptoms. First, mainly the pain starts reducing, the burning sensation will come down, the movement of the ankle and the feet becomes easy once you start acupuncture. And if started early, acupuncture is very, very promising in treating plantar fasciitis. It definitely depends on the severity. If somebody has very severe plantar fasciitis and a chronic condition, then it will take time. But recently diagnosed and early, if you come for the treatment early, then you have very good chances of getting rid of this issue at the earliest. So this is what acupuncture basically does. It relaxes the tissue, it relaxes the fascia, the layers that are beneath the heel bone and the bones that connect the heel bone to the toes. So all those fascias are relaxed, the inflammatory markers there come down, natural painkillers in the local area is released, and with all of this put together, the symptoms will come down. So this is what acupuncture does with plantar fasciitis. Along with this, cold water or hot water based on your condition, your doctor will suggest whether it should be cold or neutral water, or hot water foot immersion with Epsom salt is also something that is very, very helpful in the management of plantar fasciitis. With that, I'm sure I've given you enough information with regards to understanding plantar fasciitis and the management of it. I'm grateful for you all to listen to this video. Thank you.